At the top and all new at this hour, health care for hundreds of thousands of low-income families in Texas at risk. And it comes after Congress failed to renew funding for a federal program.
Funding for community health centers that serve the low income and uninsured is also in jeopardy tonight. Channel 5's Ana Anguiano is live in our studio with more on the impact. Ana.
390,000 kids here in Texas get their insurance through the Children's Health Insurance Program, also known as CHIP. More than a dozen community health centers here in the Valley also stand to take a hit. Tonight, insurance for children of low and middle income families is in jeopardy. Funding for the Children's Health Insurance Program, also known as CHIP, expired just 4 days ago. Tied to that is funding for community health centers across the state. You can see just how many there are in Texas, more than a handful here in the Valley.
If Congress doesn't take action very soon, by the end of this month preferably, then health centers could be looking at a significant loss in funding.
Mimi Garcia, spokesperson for the Texas Association of Community Health Centers, says the state is able to cover some of that funding for now, but that won't last for long. The same goes, she says, for CHIP.
State agency, Health and Human Services Commission, has said that without this federal funding, they will not be able to continue to cover kids on CHIP through February, that the money will run out then.
Here at home, Hope Family Health Center in McAllen is bracing for the impact. The center serves the uninsured. Medicaid, Medicare, CHIP, or any other form of coverage isn't accepted. Rebecca Stalker, executive director, says that's where issues will come into play.
The community members who are uninsured will come seeking other resources, of course, for services.
Those who previously relied on CHIP or community health centers will then rely on clinics where no insurance is needed. Stalker says that could present a problem, especially because the center relies solely on volunteer physicians.
There will be a lag time between their care, whether it's their medication or anything else that they were seeing for their chronic illnesses, or just they get sick. They may not be able to see the physician.
Stalker says it will be a ripple effect from the community health centers to the clinics for the uninsured to emergency rooms. We introduced you to Apollonio Garcia during Heart of the Valley back in March. Hope Family Health Center tends to his diabetic needs.
I didn't have a way to solve my problem because I had to pay around $4,800 for my surgery.
Garcia can't afford to wait for the care he needs on a daily basis. Without federal funding, Texas has enough money for CHIP to last until February 2018. Federal lawmakers say they're working on a plan to continue the program before funding runs out for Texas. Count on Channel 5 News to keep you updated. Live in the Channel 5 News studio, Ana Anguiano, Channel 5 News at 6.